Upright positioning. Controlling your child's pain during vaccination with positioning. Your child's body position during vaccination can affect how much anxiety and pain your child feels. Children should be positioned upright before, during, and after vaccinations.
Ready?
You can hold younger children in different ways. In a hug or facing sideways on your lap, or seated upright on a chair or on the examination table. Pick a comfortable position for your child. Provide a hugging hold and expose your child's upper arm for the needle. Hold it gently but firmly so that your child doesn't move it. Some younger children prefer to sit on their own. That's okay too. Parents can be close by to help. Avoid leaving children on their back or held down. Like adults, children can feel more nervous when placed in these positions, and feeling more nervous can make them feel more pain. Discuss different positioning options with your child's healthcare provider. You can also practice ahead of time. In public settings like school vaccinations, try to provide privacy for youth, away from others that are either waiting or have already undergone vaccination.
They would have the whole school line up, and some girls were even screaming, she said. The nurses would just give them the shot and tell them to go. Like, that's it. They just didn't, I guess, care. They just wouldn't.
Imagine how scared you would be having to watch this. You'd be the next person.
Keep items that will make children anxious out of sight, like needles. Like adults, when children are anxious, they can experience more pain. Upright positioning is one of the many ways to help reduce your child's pain during vaccinations. Don't forget to view the rest of the videos in this series. And remember, combining the different methods together will lead to even better results.